too, thanks to you, years ago.
Yes, I barely remember. What year was
Don't
it?
expect you to remember any of it, but I was shocked when you said, you need a total hip replacement. Your back's bad, but anyway,
How did that go?
very well.
Oh, good, good. Still,
That
A
was-
hip and a knee and a shoulder now.
3 years, wasn't it? One on the hip, 3 years now?
No, 5.
well,
Wow.
it
Okay.
should last at least 20, so
Yeah.
you're in good shape.
The other knee is not allowing me to do much running, so eventually I'll need that. So.
Yeah. You know, that's the problem with our, I'm not criticizing the design or anything, but like anything that goes wrong, and it kind of takes you out of the game. It could be your knee, it could be your hip, your other, and the spine, you have 5, and the heart, is that right?
That'll really take you out of the game.
That'll take you out of the game, like with the hook, kind of.
You bet.
Do you have heart trouble?
No.
Oh,
No.
good, okay.
But you know, say, what'd the guy die of? His heart stopped. That's bottom line, isn't it?
Yeah.
Yeah.
Well, in my business, it's the brain.
Oh, okay.
But I hear you. I hear you. Well, tell me about your back. What are you feeling?
Sporadic bites me everywhere. Seems to be no rhyme or reason. I do have a little trouble when I'm taking care of the Charmin Bears situation
Yeah.
with this.
On the right,
Right. And
with
that's,
getting the shoulder around.
yeah, yeah.
Okay, okay. But you mean the trouble is the back hurts, or the trouble is you can't reach?
The back. The
Oh,
back.
the back, yeah. Oh, as you
Like
go
the,
over.
by the
yeah.
kidney, yeah, right. So I
Okay.
thought first I thought it was kidney.
Yeah.
Then I thought, well, arthritis and
On the right, not the left.
well, like I say, it's sporadic. Sometimes
Yeah.
the other day I was in Walmart pushing the cart. I was looking over here. I wasn't watching up front. One of the workers had left something there, and the cart hit that,
Oh God.
and it set me. Hoo, you bet.
Yeah.
And I don't know.
Yeah.
All of a
now,
sudden
was
you-
that in the back, or was that into the legs and the hips?
back, the
It was
back.
in the back itself.
Yeah.
Okay. Are you limited in how much you can walk? No.
Oh, well.
You could walk as far as you want to.
I have a nerve problem in my feet. I'm taking gabapentin for.
And that's peripheral neuropathy?
Right,
And you're
right.
diabetic?
No.
No. Okay. All right. Interesting. Interesting. So from your point of view, your problem is back pain, and you don't get a nerve-like pain that shoots from your back on the left side around toward your groin. That does not happen. And you don't feel weakness in your left hip or lifting your knee off the ground when you're walking. All that's fine and dandy. The problem is mechanical back pain.
It's right now doing that.
Yeah.
It's biting, not
On the right.
on the right.
Okay, okay. I'm gonna check you over.
He's been complaining about his back for at least 3 years. We've
Yeah.
gone through 5 mattresses.
Yeah. What'd you do with the old ones? Can I get them? I can't use
No,
any back.
well, it was guaranteed. Okay.
Yeah.
Yada yada.
Oh, I see. I
Call
see,
us up.
Yeah.
These all the
Donate it.
others.
We'll give your money back. Show me the receipt.
Some work, some don't.
Yeah, and it didn't seem to matter if it was a $300
Yeah.
or a $900.
So, but you tried the mattress thing, didn't help. What else did you try?
I
Everything.
think the support in his in our furniture, one of the areas that goes up and down was wearing out.
Recliner, right?
Recliner. So we've got a new one, but I'm a little concerned about the time he sits in the computer, whether that chair is giving him the.
But I'm not in there more than 45 hour at the most. In the morning, I check my bank records and couple of
Move it on.
yeah. I'm not in. I'm not a
Yeah.
7 hour a day.
And you don't have trouble getting up when you have to get up?
No, it seemed like if I put my feet a little farther apart, give myself a
Let
little.
me see. Can you get up there?
Yeah, I can get up.
That's no problem. Go back down and come on back up. Can you do it with no hands? Yeah, you can do it. Come on over here. Can I check you over?
Sure, absolutely.
All right. Grab you got your thing. You're good. Now, this is going to be weird, but I want you to put your butt here and your feet here. So you're going to sit with your legs hanging off. Yeah. Okay. Bring the knee up toward the roof.
Oh,
Yeah.
the knee, not
Come
the
on,
foot.
Santa. Hold it there. Hold. Resist. Okay, good. Let's see this one. Same, hold it there. Now, those are equally strong to me. Can you feel me here?
Sure.
Does that feel the same as that?
Yeah.
Straighten that knee. Hold it. Straighten this one. Hold it. All right, let it relax for a second. I think I can do this with your coat on.
Okay, I can take it off. Doesn't matter.
No, you're okay. You're okay. Is this tender here?
No, sir.
How about this?
No.
This? 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 I see she threw her coffee at you.
Oh, really?
Well, something happened.
But yeah, that was my spaghetti supper the other night.
Ah, okay.
Whoa,
okay.
what are you doing there? Look out.
That hurts?
Well, I can feel your hand there.
Is that the usual pain on the toilet kind of
No,
pain?
well, no, I don't think so. It seems like it's higher up by my kidney. Yeah, I can feel you there.
Right there. That's what hurts. Okay. I know what's wrong with you.
Oh no.
Someone does.
He was fine
I'm
when
poor.
he met
I'm poor. I'm ugly.
you. Those are not those may be issues. but
Just
they're not
multiple
the
choice.
problem. Have a seat.
I thought we were having multiple choice here. I was giving you the gamut.
And I just asked you when you said the other day, sometimes it hurts when I take a deep breath.
Yeah, but see, that's why I thought it was my kidney and I'm afraid to sneeze because, boy, about a week ago, every time I would sneeze, it would set it up.
That kind of pain is usually in the thoracic spine, and so it's higher than what we have an MRI of. And it's not uncommon to get, at your age, a compression fracture or something else. When I felt his back, the pain was lower than that, which doesn't mean you don't have more than one problem. Pain with breathing can be something in the lung, which we usually recommend. Do you have a primary care doctor?
Oh, sure. Yeah.
Got to see them and get a chest x-ray. Make sure there's no lung issue. But if all of that's okay and it's a spine thing, then I would just wait it out. But before we get carried away, I want to show you your MRI, if that's okay.
Yeah, let's.
Yeah, here's the MRI of your spine. And can you guys see okay?
Sure.
So in this image, you see my cursor here?
Yes.
In this image, this is your back.
Right.
These are the vertebrae. The white lines are the discs. And this is the surface. This goes up toward your head and down toward your bum.
Okay.
This is your L5-S1 disc, and then the spinal canal behind it. That's pretty much normal. But see at L3-4, this disc is protruded. See how it comes out there? And then it comes out, it's right here. It's off to the side on the left. And that's the nerve which wraps around and comes into your groin and the inner part of your thigh. And you're having absolutely no problem with that. So that's not, yes, you do have that on your MRI, but that's not what's causing your pain. Where you're sensitive is here. See that white line right there?
Yes.
That's a joint. You know, if I said, what joint's that? That's my wrist, that's my elbow, that's my shoulder. That is your facet joint. They're not as famous, but
Never heard of one.
I know.
You sound like this guy.
I know, your
Facet.
facet. It is kind of like that, but for whatever reason, nobody knows about the facet joints. But they're there. There's 5 of them on each side of your spine, your low back, and they can become arthritic and inflamed like your elbow or your knee or any other joint, and yours are. That white line shouldn't be there. That's a swollen joint. And this one on the right side, see how
Okay.
much whiter that is?
Right.
That's
right.
because it's a lot more swollen.
Oh.
As we go up your spine, ooh, look at that. See that big guy?
Yeah. The
Those-
facet boy again?
That's your next up facet joint. Look at the one on the left, doesn't look bad, but the one on the right, where your tender is quite swollen.
Now, where is that?
Remember when you said, ooh, that's getting it?
Oh.
That's
I
where
thought you
that
said
is.
that was in my neck.
No, this
Oh.
is your low back.
That's the next one.
Oh,
Yeah.
next.
I'm
Oh,
sorry, next one. yes.
Okay. Well,
He has
okay.
hearing. Situation too.
Well, at least he's got a wife situation to overcome it, so that's good.
That's the problem.
Hey,
This guy's got to get us both in trouble. Knock it off, buddy.
Okay.
So I guess long story short, the MRI shows a swollen facet joint right where you hurt when I push. And so I think your problem is most likely facet-mediated low back pain due to arthritis. And the treatment is anti-inflammatories, moist heat, activities. There are medical treatments. You may have heard of burning the nerves. The pain management doctors can go in there and they do an injection to test. There's little tiny nerves the size of a hair that go into these joints, and you can numb them up. Of course, as soon as the numbing wears off, the pain would come back.
Right back.
So if you numbed it, it went away for a few hours, then it came right back. That's a positive test. Then they can go in with a needle, electrocute the nerve, and it's like a root canal. Pain's gone.
What's that name?
It's called radio frequency ablation, or RFA
Yeah, a lot of people
ablation.
talk about it.
Yeah, it's very common, very effective.
Kill the nerve.
For what ails you, it's very effective. The good news is it works. The bad news is it's temporary. Pain will come back, and the mean is 10 months.
Oh.
But so it's the kind of thing. It's not a permanent home run kind of thing. So I usually tell people, look, try the anti-inflammatories with acid blocker. So try Prilosec with Aleve or ibuprofen. Stay active. Watch your weight. Try to keep yourself strong. If those things aren't working and it flares up, we would send you to a pain management doctor to do the test of the injection. And then if that temporarily works, then the RFA, radiofrequency ablation.
Okay, now I have to take it easy. No lifting, no. Is that aggravate?
I mean, I would describe it, you should live like a prince. She should do
That'll be the.
Won't happen. He's already taken over because I'm a princess now.
Unfortunately, you are a prince because you're married to a princess.
Oh,
that's the downside. No, you can do anything that you can do in the gym on a regular basis.
No, not necessarily the gym, but around the house, around the yard.
Yeah, you can do anything.
Now, when it bites me like that, is it
Yeah.
crossing the synapse and going all the way up,
Yeah,
or what?
so when it bites you like that, you inflamed the joint further, and the muscles got the message that the joint is inflamed, and they spasm. You can probably feel it. If you feel his back when he's having that, it'll feel tight and like a muscle in spasm. A hot shower, hot water, hot jacuzzi, hot
Or a
soak.
muscle relaxant when he was real bad. I gave him and he felt better. It's like,
They're no good, but they're no good in the sense that they affect everything. They're a miracle in the sense that they do what you need, which is make you go to sleep, rest. I would take an anti-inflammatory with it and massage if you have access to it, moist heat, those kind of things.
So we're not going to get the knife.
There's no, you have a little bit of narrowing in the spinal canal, and everyone does, and life is really a race to the finish.
And I'm getting close to
No,
that.
you're
I
not.
can,
No,
I can
you're-
see the tape at the finish line.
I wouldn't agree with that, by the way, but it's you're not having any of the symptoms that go along with that narrowing, and just like that disc herniation is clearly not your problem, that little bit of narrowing is not your problem. We would never ever recommend or consider surgery to prevent a problem. You don't take a risk to prevent a risk. That just doesn't, So the best thing to do is let it roll, see what happens, and get moving.
It's just an aging process. I mean, I didn't do it by wearing cheap shoes.
No.
Or
No. It was that 7th mattress you needed. You just needed
oh,
that
the
one
purple.
more.
I thought about getting one of those one called the purple. But if they drop an egg from 700
I put
feet
my
and
foot down.
it
I
just
said, "I'm not
bounces.
doing this
It's just
anymore."
nothing.
It's not the mattress.
And the neuropathy isn't hurting any. Isn't.
I didn't test the neuropathy. That's a separate issue.
Oh.
It's not related to the
Okay.
spine.
Okay.
And
It didn't go up.
Did you see a neurologist for that?
he's
No,
only seen
no.
his
Just the
GP.
the GP. He said, "Red, this is about as good as it gets." You see that crap on TV. They said that's snake oil.
He's right. There are.
He went to Michigan State too.
He's a Spartan.
Yeah.
There are the definitive test for neuropathy is EMG, electromyogram, and you could go get the test. There are 50 causes. 49 of them are not reversible. You should take a B vitamin if you're not already.
Well, I would take a multiple, but not a one of the B complex.
So there's very few conditions that can cause nerve problems, but one of them is if your vitamin B level is low. And so you can follow your B and blah, 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 but an easier way is just buy a bottle of B vitamins and take them, and when the bottle's empty, buy another bottle. Just
That's the best you can do then.
Yeah.
Along with the gabapentin, or is that snake oil too?
No, the gabapentin usually is very helpful, very good symptomatically, if you're having no complications from it.
Well, I don't.
Headache, confusion.
Oh, no.
Multiple mattresses. Wait, what?
Yeah.
No. If you're tolerating it well, how often are you taking it?
Twice a day,
Yeah,
300
right.
twice a day,
So-
morning in 12 hours.
Yeah. So, if you're not sure if it's helping you, I would consider talking to your doctor about stopping it and then going back on. And you might find that it's
See if
helping you more than you think. If it's not helping you, why are you
For the
taking it?
pain, you mean?
Right,
Yeah.
right.
Well, it's relatively cheap.
Yeah.
I mean, I'm not, it's not breaking me to take it. Not like,
It is a neurological medication, so it does have psychoactive properties, which as you age can become not the good kind.
Oh,
It can,
no.
but No one,
See,
no one ever abused
I have an excuse.
gabapentin.
I have an excuse.
Yeah,
I'll fill it with sugar water.
there you go.
Sugar free.
Sugar him up.
Yeah.
I want you to know I did everything I could for you today. I tried to get her to treat you like a prince, and she refused. I tried to get you off that medication.
Does, because of my back situation, I was told not to vacuum, sweep, rake, or anything like that. Would that affect his?
Yeah, it's a joint problem, so any usage can definitely affect it. But it's kind of an Occam's razor, because if you don't use it, you lose it.
Right. You said
So you
activity.
Yeah.
Right.
So if it's moderate and.
Yeah, I mean, this is really the kind of thing where I usually say, pick an exercise, do it 4 or 5 days a week, and then don't do anything that's more strenuous than that exercise you know you can do safely. So that's kind of the easiest way to. If you're not an exerciser, you're not going to start at your age, and so it just becomes.
Well, he does all the floors, which is a godsend.
Yeah.
But it does
And
require
Friday's
a lot
Friday's
of
vacuum day
twisting
too.
and-
Well, you got to. It's not damaging him. If it doesn't hurt, it's not damaging. If it hurts and then it hurts the next day, it is.
So when I hit that whatever that thing was at Walmart, just the whole jolt.
No, so your body was moving with momentum.
Okay.
And you didn't stop. That joint absorbed all that force.
Okay.
And it's a bad joint.
But it lit me up. Boy.
Oh yeah, buddy, it hurts. I mean, it's easier. The reason the facet joints have such a bad PR agent is that they're under the muscle. All the other joints are on the surface. That's why
Right.
you know about them. But think about it the same way. If you had a bad knee and you were running and you stopped suddenly, do you think your knee would hurt? Oh yeah, it certainly would. That's exactly what happened to you. Your body absorbed the force of that collision, and that joint is hurt, so it lit up.
Boy, that was a tough one there.
Yeah.
Well, I won't hit any cars on the way.
Okay.
Let her do the shopping. You do the
Well, she
floors.
spends too much money when she goes by herself.
Jeez.
I don't think so. I don't think so.
No, we don't show it, hon.
Yeah, we sure don't.
All right.
All right, doctor. That's
I think the way to proceed here is let us know, and I think it's going to be you. If you feel like he's getting worse and there's nothing you can do, call us. We'll get him in we'll refer him to someone for. Where do you guys live?
Right,
Goodyear.
Okay. So Dr. Anne-Cherie Fox is our pain management doctor out at our center there. She's excellent. This is right up her wheelhouse. If you need help, we'll get you in to see her and go from there.
so. I should have a chest X-ray from my GP,
Yeah, who's your GP?
Kent Johnson.
Ken?
Yeah, Kent.
Ken? Oh, Ken Johnson.
Kent
Yeah.
Johnson.
Yeah, so call Dr. Johnson, tell him you're having occasional pain with breathing, and he'll order a chest x-ray.
Okay.
Yeah.
Excuse me, does Dr. Fox work out of Goodyear area?
Yes, she works out of our Goodyear ASC, which is on Litchfield Road in Van Buren.
Right,
Yeah.
it's a great office.
Yeah.
This one's a little harder to get to
Yeah.
with the traffic. But
Well, it was a
So
miss.
that one will be better.
It was a miss coming down the 10.
Yeah, well, you better get home before 3.
Yeah, we're going right now.
Yeah. All right, guys, nice to meet you.
Thank you. Thank you.
Yes, nice to see you again.
Thank you very much.
Yeah.
Take
You want to
care.
undress me there, cowboy?